Today we're going to be talking about rheumatoid arthritis. So that is an autoimmune disease that affects the connective tissues, typically within synovial joints, so joints that are bone articulating against other bones. So it's going to be like your fingers, your elbows, shoulders, hips, knees, toes, all of those. So those are going to be the ones that are mainly affected. Really severe cases can lead to especially in the fingers and the toes, can lead to deformities within the joints. So what happens is it's an autoimmune disease. So autoantibodies transform into rheumatoid factors, and those cause the inflammation because they attack healthy tissues, causing an inflammatory response, which is what leads to the pain and, in the severe cases, the deformity as well. So when we're assessing for rheumatoid arthritis, in early stages, it presents with joint stiffness, pain, mild inflammation. Your patient can have fatigue. They can have some general weakness if it's in the lower extremities because of the way it affects those joints. Late stages, just progressed inflammation, pain, swelling, and in the late stages is when the deformities will occur. Labs, we are going to look at the erythrocyte sedimentation rates. Those will be elevated, and so will the C-reactive proteins, and those will show the inflammatory response. Treatments for RA, methotrexate is one of the big ones for that. Also NSAIDs, so like ibuprofen to help with the inflammation as well. But you want to give them NSAIDs instead of steroids, because the steroids can help, they'll make the autoimmune worse. That's why we go with the NSAIDs, because you don't want the steroids, because you don't want to increase the reaction. Some complications along with it, they can have weight loss, fever, the subcutaneous nodules, which are those little deformities, if you look like on their fingers, there's little bumps on them. Severe cases can have cardiac and respiratory associations with it. Vasculitis. They can develop warts on like their fingernails and their toenails, like right around the edges. And then paresthesia, which is like a numb or tingling feeling around those joints as well. And RA is often associated with other conditions, or can lead to other conditions, such as Sjögren's syndrome, which is also an autoimmune disease that attacks the glands in the eyes and the mouth, so it leads to really, really dry eyes and dry mouth. Felt syndrome is RA with splenomegaly and neutropenia, so they have enlarged spleen size and they have reduced white blood cells. So they're at severe risk for infections because of the spleen enlargement and the reduced white blood cell counts. And then Kaplan's syndrome is swelling and scarring of the lungs along with RA. And typically the lung scarring is due to like dust inhalation, so it's really common in like coal miners because of all the coal dust that they inhale. You're just going to talk to your patient about taking their medications to help their the progression of their disease, but there's not much you can do in the way of like curing, since it is autoimmune. So that's what we're going to do with RA.